Okay, I'm Dr. Betita. I've been tasked to lecture on writing the introduction to a research paper. And these are my objectives. Actually, as you can see, my objectives are all all of these are part of the outline for your um, research introduction. So the epidemiological cycle begins with noticing that a disease problem is in that there's a disease or problem in the population. We perform descriptive epidemiology, namely your case control, case series, your prevalence studies. From there, we perform hypothesis generating studies. We test the hypothesis using analytical epidemiology. We attempt to remove a risk factor or add a preventative factor by performing intervention studies. And then we assess the intervention through a clinical trial. And then the cycle repeats itself anew. And this is the epidemiological cycle in research. So this is just a brief overview of epidemiological studies. So there are experimental studies like your randomized control trial, your clinical field and community trial. You have your observational studies. You have your hypothesis generating studies, namely your descriptive studies, your ecological studies, and your cross-sectional studies. You have your analytical studies, which are hypothesis testing, like your case control and your cohort studies. And your randomized control trials are also hypothesis testing. Increasing strength of epidemiological evidence increases as you move to the right of this table chart. Okay, so the parts of the research proposal as follows: statement of the problem, objectives, hypothesis, theoretical, theoretical or conceptual framework, the significance of the study, scope and limitations, and definition of the terms. Take note that this is by no means a hard and fast outline. So it may be that some of the components of this outline might be combined, but all of these components must be available at least implicitly in your paper. So your research question was discussed last week. So a good research question contains the following: population, intervention, comparison, outcome, methodology, or your population exposure outcome, whichever one is more applicable. All of these must be clear in your research question, and they must also be present by extension in your objectives as well. So what are objectives? They are what the researcher hopes to achieve, or the outcomes that she or he is hoping to be produced in a study. They are the solution to the research problem. They define expectations for research, and they give the directions for the research. So why do we need objectives? They indicate relevant variables. They give the researcher an idea of what research design or methods to use. They tell you what data to collect. They're useful in planning the analysis of results, and this is the basis for interpreting those same results. So the general objective states what is expected to be achieved by the researcher in overall terms. It is what the researcher hopes to achieve, or the outcome that she or he hopes to see produced in the study. It is the solution to the research problem, defines expectations, and gives the direction again. Generally, the general objective is derived from the research question, so it's just restated as a declarative in the declarative form, from the interrogative to the declarative form. Okay, specific objectives breaks down a general objective into smaller logically connected parts. So the key word here is smaller logically connected parts. So you start with the general objective and you break it down into specific components or the various steps that you need to take in order to answer the general objective. So again, general objective, you break it down into those components that you need in order to answer the general objective. And those components are your specific objectives. So for example, if your general objective was to determine if Sambong can decrease serum cholesterol in middle-aged Filipinos versus simvastatin. So your population here is middle-aged Filipinos. Your exposure is the use of Sambong versus simvastatin, and your outcome is serum cholesterol. Okay? So your correct specific objective is to determine LDL levels of middle-aged Filipinos after giving Sambong versus simvastatin for 6 weeks. So why is this one an incorrect specific objective? It is because getting the blood pressure has nothing to do with the general objective. Okay, so it's not included within the scope of the general objective. It's extraneous to this. So why would you need to determine the blood pressure if that's not one of the outcomes that you're seeking to measure. Okay? So specific objectives, this systematically addresses the various parts of the research problem. It specifies all that you need to do to answer the general objective. So when you put the specific objectives together, they should all lead to the answer to the general objective. Okay? So the steps in writing your objective. First, identify the major focus of your research project and the main goal that you want to achieve. Break down your research focus into smaller steps and separate objectives that are specific, measurable, achievable, relevant, and time-bound. Write your research objectives in a clear and concise way using appropriate verbs to convey the work that you will do for each one, and explain your research objectives in your paper. For example, and if this is your general objective, to determine if Sambong is more effective in decreasing serum cholesterol in middle-aged Filipinos versus Simvastatin, these are the steps that you need to take in order to answer that question. Okay, number one, you need to determine the baseline lipid profile of middle-aged Filipinos. Step two, you need to determine the lipid profile of middle-aged Filipinos after being given Sambong versus Simvastatin for 6 weeks. And step three, you need to perform statistical analysis if there's a statistically significant difference in the lipid profile between the two comparator arms, namely Sambong versus Simvastatin. So you compare the two groups as the last step, and you perform the statistical analysis if there's a significant difference. Okay? So if you perform specific objectives 1, 2, and 3, that will lead you to the answer to your general objective. Okay? Characteristics of a good objective. They are phrased in such a way that they focus on what the study is trying to solve and cover the different parts of the problem in a logical way. They are phrased in measurable and operational terms, specifying exactly what the researcher wishes to do. They are realistic and should be feasible, and they use action words which are specific enough to be measured and carried out. Research objectives state what is to be achieved by the study, and they are stated in the declarative form. So it is to do this, to do that. Sometimes objective is interchanged with the words aim, purpose, intent, or goal, or any other synonym. So there are other synonyms aside from objective. Objectives must show the desired outcomes, the populations under study, the independent variables, the groups compared, the levels used, the variables to be observed, and the conditions under the study. So briefly, let's review quantitative versus qualitative studies. So qualitative studies answer why questions. The data is observation, words, symbols, etc. The approach is through observation and interpretation, and the data is analyzed using non-statistical analysis or grouping of common data. Quantitative research, on the other hand, answers how many, how much. These are numerical questions. The data is numerical or a statistical result. The approach is through measuring and testing, and analysis is typically done through statistical testing. Verbs commonly used in quantitative study are action words that are specific enough to be measured. So for example, to determine, to compare, to calculate, to test, to evaluate. All of these will result in a numerical result. Okay? And that is the nature of quantitative studies. In qualitative studies, on the other hand, these are non-numerical findings. Typically, they use verbs like to describe, to explore, to understand, to discover, to develop, to generate, and other similar terms. Okay, for example, in this cross-sectional study, the population is children in Metro Manila. The exposure is leptospirosis, and the outcome of interest is the magnitude of leptospirosis and its risk factors. The general objective is to determine the magnitude of leptospirosis and its risk factors among children in Metro Manila. The specific objectives would be to determine the prevalence of leptospirosis and to determine the prevalence of selected risk factors among children in Metro Manila. Okay, moving on to hypothesis. So a hypothesis is a prediction of a relationship between one or more factors and the problem under study which can be tested. There are two kinds of hypotheses, namely your null and alternative hypothesis. Null hypothesis means that there is no real difference between the means or proportions of the groups being compared, or that there is no real association between groups. An alternative hypothesis, on the other hand,
is that there is a real difference or that there's an association between groups. There are two kinds of alternative hypothesis: unidirectional or one-sided, and bidirectional or two-sided. A research hypothesis, a conjectural statement of the relationship between two or more variables, researcher's prediction of the researcher's findings, organized efforts of the research, it identifies what variables are involved, and it enables researchers to understand the problem and provides a framework. They are working instruments of theory and can be tested empirically. So non-directional hypothesis simply states that there is a relationship or difference between groups or variables. For example, first-year biology students who learn online this semester have different grades than those that learn in the classroom. Bidirectional hypothesis, on the other hand, states the direction of the relationship, or the difference between variables and groups. For example, biology students who learn online this semester have higher grades than those who learn in the classroom. So higher, so up, so there's a direction. Null hypothesis. Null hypothesis means that there's no relationship or difference between variables or groups. Example, the grades of first-year biology students who learn online this semester are no different than those who learn in the classroom. This is your statistical hypothesis. The null hypothesis is usually expressed as H0. There's no difference between groups. And the alternative hypothesis is H1. There's a difference between groups. So guidelines in writing hypothesis. In experimental studies, hypotheses are explicit. In descriptive and historical studies, hypotheses are not explicitly stated. They are usually implied. And instead of stating the hypothesis directly, they usually show a line of inquiry. So line of inquiry is the type of questions or the type of answers that you're looking for. So for example, in a phenomenological study of teachers, of the lived experience of teachers who taught during the pandemic, you're trying to explain the lived experience, or you're trying to show, rather, or exposit the lived experience of teachers who are teaching during the pandemic. Hypotheses are stated in the null form and generally are formulated from the research question. So guidelines in writing hypotheses. First is avoid value judgment. So avoid words which imply judgment, like better than, or ought to be, or should be, or poor. Why? Because this implies bias. So you don't want to make a judgment on the outcomes actually of a particular research before your research has already been done. So for example, medication A is superior to placebo in reducing dizziness, or non-cognitive evaluation is inferior to cognitive evaluation in predicting board exam performance of medical students. Online classes are better than face-to-face classes for teaching skills to working professionals. All of these imply a value judgment. It implies that one outcome is better than the other. So you want to avoid making these kinds of statements in your introduction. So theoretical framework. So first, let's discuss what theory is. So theory proposes well-substantiated explanations of phenomena or an observable fact or event. So for example, the theory of gravity, Newton's laws of motion, etc., etc. So these are explanations of phenomena. A theoretical framework is an explanation of the theories used in a research, or provides a research with context by identifying assumptions that inform their work. Typically, this is presented as an algorithm, and it's used interchangeably with conceptual framework. So an example is this one. So this one is a case series involving newborns who are affected by both HIV and schistosomiasis. So this is the conceptual framework, which highlights the theory of what's happening to these children who have concurrent infection with HIV and schistosomiasis. So an infant with HIV is likely to have failure to thrive and fast AIDS progression if they are not treated with they are not treated properly with praziquantel. Okay, versus an infant without HIV, which has a better clinical outcome with or without treatment. Okay. Sorry, with treatment pala. Kasi both of these were treated pala. Okay. All right, so critiquing research questions, objectives, and hypotheses. So how do we determine if a research question, objective, and hypothesis is well written? So these are the questions that we typically ask when we're reviewing your work.
So is the research problem easy to identify? Is there a statement of significance of the study? Is there a good fit between the research question and how it is being investigated? Does the research question have clear objectives, questions, or hypotheses? Are key concepts identified? Are verbs used appropriately? Are hypotheses properly worded? Do they state a predicted relationship between two or more variables? So operational definitions, this is the specific way in which a particular variable is measured for that study. It is the definition of a variable in terms of the actual procedures used by the researcher to measure or manipulate it. It specifies exactly how to measure or manipulate the variables in a study. A good operational definition defines procedures so precisely that other researchers can replicate the study. So an operational definition of a variable is exactly how a particular word is used within the context of a particular research. Okay, so it is how a particular word or how a particular variable is used within that particular research. So nominal conceptual definitions, these are definitions found in dictionaries or textbooks. And the operational definition is how a word is used in research. So measured operational definition describes how a variable is to be measured. Experimental operational definition spells out the details of how an investigator manipulates a variable. For example, how an investigator reinforces or rewards certain behaviors versus not reinforced or not rewarded for certain behaviors. So this is how an investigator utilizes or manipulates a variable. Okay. So types of variables, there are generally four types: independent, dependent, confounding, and background variable. The independent variable is what is being manipulated. It is the variable that causes the change in the dependent variable. It causes the variation in the event of interest, what is being manipulated by the researcher, and there being more than one independent variable. In contrast, your dependent variable is the measure of what is being explained. It is the outcome or effect that you're looking at. Confounding variables are variables not included in the research or not held constant, but would have a probable impact on the outcome of the research. So there are two types: extraneous, which are any variable other than the independent variable that would cause a change in the dependent variable. Intervening variables are variables that arise during the course of the research and can be difficult to control, which can alter the results of the research. The significance of the research. The significance of the research, you need to ask who has an interest in the domain of inquiry, what we already know about the topic, what has not been answered adequately in previous research and practice, and how will this research add to knowledge, practice, and policy in this area. So these are the guide questions that you should follow when writing the significance of the research. Your scope and limitations. So review your research problem and objectives in order to elicit the scope or coverage of your study. So you write down hanggang saan ba yung parameters ng research mo, hanggang saan ba siya, what are the possible biases and confounders and how you minimize these, what can go wrong, how can you keep things from going wrong, if things do go wrong, do you have a backup plan, what are the possible consequences if things go wrong, and what variables or factors are not covered by your research. Lastly, the definition of terms. You define terms as used in your research, and this is usually given as a glossary. All right, so thank you for your time.